Derek, how are you?
Doing great. How you doing today?
Very good. So let me introduce Derek, because now we've gone from a very experienced doctor, like Waji Khan places 1,000 implants a year, okay, and he's very knowledgeable. And then we went to Milan, graduated George Brown, okay, in the dental technology program, worked in a lab, in a small lab, large lab, in a dentist office. He embraced technology. Now we come with Derik Ayers. He comes from one of the most popular lab in the US right now, okay? And they have, like Absolute Dental Services, Conrad is the owner, and we've had other speakers from there in previous years. And so we reach out to them on a regular basis. So this year I reach out to Conrad, and we have Derik Ayers who's joining us. What makes Derik unique is one of these guys, okay, that he doesn't have a dental technician or a denturist degree, but is one of those guys that is coming from technology and fitting in the dental world. And this is going to happen again. A lot of the time when we say things, people goes, "Oh man, Tori, what do you talk garbage sometimes?" No. Let me give you something, guys. In British Columbia right now, let's look in the dental technology. They have about I'm talking about in their association, the numbers are going down, and I don't know if I have about 180, I forget, but 180 to 200. But guess what? 70% of them are over 65 years old. Who's going to replace this guy at the bench? So the concept of getting people that are knowledgeable, okay, in digital, they have, they know materials, and they've studied, and and shape them to fit into the industry, is going to become a reality, because there are not so many of them. So let me give you a little bit of Derik's background. Is the director of digital removables at Absolute Dental Services in North Carolina. He started his career as a technician in the digital world and continues his journey by streamlining the additive manufacturing process at Absolute, which is a very, very busy lab, okay? And of course, to do the removal. Derik is the epitome of the new generation of dental technicians who specialize in digital dentistry, supported by end process artistry. He's got, like a 5-year experience, okay? He's graduated from Wesleyan College on extra science. We don't even have this topic, I don't think, in Canada, Derik. But we're happy to have you here. And today he's going to lecture to us on digital dentures. The future awaits. Please share your screen, Derik, and we will be listening to you.
All righty. Let's go ahead.
Perfect. Okay.
All righty. Well, thank you for that introduction. Like you just mentioned, I am newer to the realm of dentistry. My wife is a prosthodontist, so that does help me on the learning of the dental world and navigating the new road to the digital dentures. Great thing about myself, like you had mentioned, I don't have the major background with schooling in dentistry, but my life is revolved around that. Like mentioned, in the removables department, we are constantly busy. We are always trying to evolve and grow the digital realm. We are hugely enforcing the digital realm and digital dentures, and it is a daily task of seeing how we can improve our procedures from the lab aspect to chairside. And that is a great thing with my background. With my wife being the prosthodontist, I do get to see and hear from both sides very closely, and see how I personally can help her do her job more efficiently. So today, we're going to be discussing is going to be the digital dentures. We will touch base on some fixed as well, and just the benefits that digital is bringing to the realm nowadays. So we can go ahead and we'll get started with this. Where I would like to start, we're going to go back in time. We're going to start discussing where digital dentures began, and how the feedback has grown and helped us evolve and grow digital dentures. So, of course, Avident was founded in 2011. Ivoclar launches milled dentures in 2018. At this time, this is when we had our generation 1 digital dentures. At Absolute, we did not jump on board with digital dentures at this time. The initial response from digital dentures were they were not great looking, they were brittle, they just weren't aesthetic. That put a lot of people off and kind of put a name to digital dentures that nowadays is just not as accurate. So as you can see here on the screen, I'm sure lots have seen these photos before. These dentures, being that generation 1, you can just tell they just weren't as aesthetic or beneficial to the patients or the doctors. Now, in 2019, Dentsply partners with Carbon and announces Lucetone 3D print. Desktop Health launches Flexera in 2021. Now, this is when Absolute starts jumping on this bandwagon. Once we do have a Carbon and Desktop, they have the Einstein. So I will be touching base on these 2 printers mostly today. These are what we have found to be kind of the 2 sides of the fold that brings digital dentures together and really gives you the results and the benefits of a digital workflow without all the drawbacks. Now, of course, the big thing that I personally have been blown away by is Flexera. Flexera, released their Flexera Smile, and these do come with their Flexera Smile, the 6 shades, and the Flexera Base with their 5 shades. What this is giving us is the option to make sure that we can match the patient's denture to their tissue shade, and also have the variety of 2 shade options that are available in the market. Now, as you can see here with the 6 shades, what I do like to note is that these are printed teeth structures. So with the Flexera Smile, we do also have the option, and we'll touch base on this, the mix and match of denture bases and denture tooth structures. Of course, we'll be discussing milling. And at Absolute, we still have our mills running, and we mill the shades of teeth and milled options that will still work with our digital dentures, whether that's a milled digital denture or a printed denture base. So we do have all the options. That's what's great with Flexera is they allowed us to open the door to lots of options. And with those options, the thing to take into account is once we start this process of a digital denture, the repeatability. So once you have the denture that a patient likes, the doctor likes, we do have the option to make sure that we can print it in any base shade, any tooth shade, and every single time is going to come out the exact same. If a patient went a few years and now they wanted to change their tooth shade, we have that option to mill or print the exact denture. It'll be the exact same denture that they received from the start, but with the upgrade of a shade or a change that they may need. Going back, initially digital dentures were only able to have a carded tooth. As you can see here on the screen, what we're seeing is when we digitally design, with this particular case, this would be a maxillary edentulous arch opposing a lower mandibular arch with some existing teeth still. And so the occlusion would be set up digitally designed, showing there in the blue where we would be occluding heavy for the proper tooth position. And what this was causing, this is a great option, but at the same time, with this digital design, we would manually have to go in and remove these areas by looking at these images. Now, what that's doing is that's introducing more error, human error. Once a technician is, we have an image to give us a guideline of what we ideally should be removing, but maybe we don't remove enough. Maybe we remove too much of the tooth structure. Now, when the doctor gets their denture, they're going to be out of occlusion in particular areas because of human error. That's going back to having a printed tooth structure is going to give us the ability to do any particular case and design perfectly in occlusion. Now, with these materials, what we're going to talk about is the long chain chemistry that gives it the strength and the benefits that we are looking for nowadays. Now, what makes it strong? This goes back to all the research shown that the material is going to have a higher, longer chain, giving it the strength. We're going to touch base on this here shortly. So what we see here is going to be, I like to touch base on the Flexera versus the Lucitone 3D print materials. We can see there on the left side of the screen, the Flexera base at 3667. That's the amazing number at room temperature. Now, comparing that to Lucitone 3D print, which we do print a lot of our bases out of Lucitone, that is at the 1400. That is, again, at room temperature. I do like to mention that those at room temperature are a lot lower. Of course, once those go into the patient's mouth and are at the body temperature, the Lucitone 3D print is going to jump up closer to 3000. Now, being as amazing that is, it's still not quite as strong as the Flexera base. So now we're looking at the Lucitone 199, our Lucitone digital print, and our Flexera base. You can see the numbers there and how beneficial some of these print materials are with their long chain materials and the high efficiency printers that we're using nowadays. Then again, on the right side of the page, we're going to be looking at the Flexera Smile. This is the moisture absorption that we're looking at. Now, having that low number is amazing, 1.96%. That's showing the absorption rate is super low, and that's going to help with, you know, the porous material. We're not going to be having as much staining or as much bacteria that's going to be growing or retained on the material. So those are great just to look at just the numbers of the strength. We are improving right off the jump. Now, backtracking to the generation 1, materials being brittle and unaesthetic. As you can see here, now we're getting materials that are going to be stronger and less porous. So we're going to be seeing longer lasting dentures, and we're able to get this material much more aesthetic. So I do like to touch base, I guess, on a study that we did at Absolute. We did like to call it SCAR. A little bit of a joke here, but at the same time, this is great to show well, what we can make happen. So as you can see here, this is SCAR. SCAR is one of the pets at the lab, and you can see there in the denture, we actually threw some peanut butter. We clobbered peanut butter all over this denture and let SCAR go to town. We took hundreds and hundreds of photos to make sure we got this photo here, and you can see that peanut butter is still in the teeth. And of course, at the end of the study, SCAR was happy. This was chewed on by SCAR for quite a while, and as you can see, the denture is still held up. But back to the real talk of digital dentures. What we have here is going to be our Einsteins. Now, I like to mention that the Einstein Pro is no longer in production. The Einstein Pro XL and that regular Einstein. These printers are amazing. And I like to mention that these are very affordable for labs across the nation or anywhere. Comparatively to the carbon printers, the Einsteins are one of the printers that I've found that are one high resolution, but also on a budget. It's a great printer for the results you're going to be getting. And what this does, the Einstein, the way that it's printing is printing at a higher wavelength, and at this higher 385 wavelengths, what that's getting is a harder material and more a clarity of the print. And that's what we're shooting for when we're looking for printers. That higher wavelength is giving us a more efficient cure. And I believe earlier we had already touched on how your product's being cured, whether you're getting a resin on the outside of the material and how it's cleaning. So with this higher efficiency cure, you're going to get more accurate fits on your dentures and tooth structure, but also, you know, preventing breaking or brittleness in the future. Let's go ahead and skip past that. As you can see here, this is a night guard. I do like to mention, you can see the stunning clarity on the left. That is because this is from a printer at a higher wavelength, getting that better clarity. I do like to mention at this time, I know we were mostly going to be talking about digital dentures and fixed dentures, but at the same time with night guards, one of the key things that I like to mention, the industry is transitioning to digital, and we have had great success at Absolute with our night guards. The Keystone Soft is an amazing material, printing at a higher wavelength. Getting that clarity, you're going to get a denture or night guard that's going to last longer. It's going to not stain as quickly. That material itself, the Keystone Splint, I don't have a slide here to show you. It's fantastic. I do prefer the soft Keystone Soft over the Keystone Hard. And I do have some pushback from doctors wondering, they want a hard night guard. Something to keep in mind with Keystone Soft. If you grab one of these guards, if you have one in hand, you could bend and pull on this thing. It is a hard material. It just is labeled soft. It has that little bit of flex, which I think is beneficial to keep in mind for night guards. As a patient's grinding and clenching, if you have such a high glass content material, it will cause it to shatter. This Keystone Soft, Keysplint Soft, is actually going to give it that a little bit of flex, so that way when a patient is grinding, it will have enough give to not shatter, but it would not be noticeable where the patient is going to be grinding and clenching on the denture all night. So this is a tooth structure that was printed on the Einstein out of Flexera Smile. As you can see here, this is from the print. The only thing that's been cleaned up is the supports that were on here. So as you can see, you get stunning results from our printers with minimal bench work. And as you can see, this is how we would print our tooth structure. We do at Absolute print in a single arch. We do not split, as some manufacturers will recommend doing a 3-piece tooth structure. The benefits to one piece is just the ease of installation and how it's applied to the denture, and also just not introducing as many human errors. If you have 3 pieces, the individual fusing the dentures will have to be more precise and making sure that everything's pieced together correctly. And that's also introducing more faulty fault lines. So going back to some studies, we're going to touch base here. This was a study done by Wendy Clark. And what we're seeing here is going to be a conversation between conventionally processed dentures versus our digital denture or workflow. And as you can see, 50% of conventionally fabricated dentures had 6 or more visits, while only 5% of digitally fabricated dentures had 6 or more visits. The difference in numbers of patients' visits is significant. Additionally, the conventionally fabricated dentures require an average of 2 to 3 post-op visits. So what we're looking at here is just basically showing the amount of visits to the doctor. If we have going the traditional option and we're going to the office 6 or more times, 50%, and then we have the option to drop that down to 5% having the same amount of visits, that's going back and looking at what is the patient looking for and what is the doctor looking for. Having the ability to consistently have less visits with better results and less follow-up is kind of what everybody's looking for, from the doctor to the patient to the lab. The results of this is just going to be the convenience for the patient. Overall, the doctor and the patient, the chair time and the patients is what we're looking for. If we have a patient that is driving 2 to 3 hours trying to get to the doctor's office, having less visits is going to draw that patient to that office, get better reviews, get better feedback, and more business. So that's the benefits to the digital workflow, as we can see here in the study. Now, the way this is achieved is, we will cover some of in the future here in a few slides of converting different types of patients to a denture. But the best way, and I can walk you through of how we're cutting down on these visits, is that the first visit, most of the time, we're gathering a bite. If it's fully edentulous, we're still starting with a wax rim. But that after that first appointment, we go to the lab and we're going to fabricate a digital denture. We will start with a monolithic try-in. And at that appointment for the doctor, at that first to second appointment, we're going to try that denture in. And what's amazing about these try-ins, they're no longer with the digital workflow. We're not doing a base plate that's somewhat going to fit the mouth. We are printing a denture that's going to have the exact intaglio that our final denture is going to have. At that first visit, if the denture does not fit in the patient's mouth the way the doctor wants the denture to, or the patient feels is comfortable, we can make those changes. That try-in will be the exact as the final. So make that adjustment, whether it's adjusting a specific area or doing a light body wash. A lot of times that light body wash is what we recommend is going to give us that new intaglio to be more comfortable and fit correctly. Once they send that back to the lab, we will scan that in ourselves. The doctor can do it there at the lab or at their office. They like to cut down some time, but having a benchtop scanner is beneficial to get a better reading or scan on that intaglio. And then once we scan that intaglio, we can do a second try-in or go to final. And that's where we're cutting down time. We're not worrying about trying to get that base plate to seat correctly. Maybe it's shifting around or moving, so maybe it's adjusting the bite from time to time. We have that exact intaglios from start to finish of exactly how it's going to fit at final. The two setup, the same thing. During those try-ins, we have the ability to make adjustments or take a new bite to fix those. So we are reducing, and from time to every single case, as these come to the lab, from the bite rim to the first try-in, the second try-in, we are scanning those in, and those can all be aligned. And we have an exact workflow of the changes that have been made and what has worked. So another study here by Nate Lawson at UAB. As you can see here, I'm going to start this video in a second. This is going to be the stress test on the materials that we have on the market. This first video, you'll see it'll play all in one. The first material is going to be a high glass content material that does shatter. What's great, about the material is it's very in the high glass content. It has a low wear resistance, but you'll see with this machine that it's going to shatter and explode. After that explosion, the second material is going to be our Flexera Smile. And as you'll see, what's going to happen is it's going to bend, flex, and then snap back in to its original shape. So as right now, I'm going to go ahead and hit play on this video, and you can see it snap. Now, this is the Flexera Smile, and you'll see it will just keep bending and bending. As it bends, doesn't shatter, it'll snap back. There it goes. And where that comes into play is, again, if we're looking at a two structure, we're trying to find that happy medium of where we're going to get a low wear resistance, but also not have teeth breaking and shattering on us. If a patient's wearing the denture, they get hit, or if they drop their denture on the floor, lots of things can come into play. So that's where we're looking at the materials on the market right now, the benefits of high glass content, or if we're trying to find a material that's not going to shatter. We're going to review these numbers here in a moment and show you where we sit at absolute with the best results. The next video here is going to be of the chewing simulator. And these are a few materials just going through the chewing simulator and the results. So this is a volumetric wear. So as you can see on the far left, that Flexera is very low, which is a good thing, showing that it's very low in wear, the Lucitone on the far right being a little higher. So even though Flexera, as you saw in the first video, would bend and not break, we still have a great wear resistance. And now on X, has a higher glass content, so it has a great wear resistance still, but you saw the results of it being bent and snapping and exploding. So when I'm looking at that, I see Flexera has the lower volumetric wear, but also has the benefits of that flexibility to bend without breaking. This is why at Absolute we are going with the printed 2 structure with Flexera Smile and sticking with it to date. All right, so now we're going to touch base a little bit about our fixed prostheses. So what's great about the digital workflow, it's not just digital dentures. We're going to show a few here. You can see on the screen, these are digitally printed prototypes or hybrids that have the tie bases installed, and they still come out looking beautiful, but they are a printed prototype. This one is by Lars Boma, and you can see there on the left was where we sent the prototype for try-in. They could wear these for a few months, verify. And then on the right there is the Zirconia Final. These are exact copies. So this is the benefit of the digital workflow. Again, repeatability, time in, time out. Whether it's, keeping it in the digital realm or the printed realm of a denture or on a hybrid, having the ability to finalize from the exact copy of the try-in. Workflows. So of course, the workflows are always the fun part with digital dentures. The edentulous, it is. We had actually already touched today on the edentulous patients, and yes, at Absolute, we do start with wax rims or bite blocks, whichever you prefer. To capture a bite, that's kind of the traditional way of capturing a bite, is those wax rims. And even with the digital workflow, that is going to be, in my opinion, the best route. And what's great for that is for the doctors, being chairside, that's what you're used to. When we start talking digital, a lot of professionals out there start weaning away. I don't have a scanner. I don't know the workflow. And that's what's great about the digital workflow is, even with it being edentulous, we're still going to stick with some of the fundamentals that have been shown tried and true for years and years. We'll start with those wax rims. So on the patient's and the doctor's side, it's the exact same workflow that they're used to. Once they send it to the lab, that's where we can digitize and start going digital. And it does not require the doctor themselves to be upgrading their equipment with new scanners or printers. This is done at the lab. So edentulous, it would starting from wax rims, and then it goes to the digital try-ins to the final. Immediates, same thing, absolutely amazing. I mean, if we have a patient that has dentition already, we have a VDO, we have a midline, we have records, that is the simplest way of a workflow for digital dentures. We were able to gather that, first appointment, once we get that scan or we get that bite, we get that impression, we are able to start right there, right away to even a try-in, which is amazing. What we do at Absolute, we will actually take the scans or the impressions sent to Absolute and scan those in, design a full denture. Go ahead and design our full maxillary, even if it's a full maxillary mandibular, design those dentures so that we have the ideal setup. And what we do is what we call a cut try-in. We will remove the teeth from the denture where the patient still has dentition. And what's nice about that is they can go ahead, do a try-in before extractions, verify that they like the bite, they like the tooth structure, they like the size, because of course that's what we're looking for, is making sure the patient is happy with what they're receiving. And then from there, the day of extraction, once we have approval, we can go to the final immediate denture and send it to them for day of extraction for insertion. Existing denture and duplicating dentures, we saw this a lot during COVID. With everything being down, patients were wanting to do things with the least amount of visits, trying to not have exposure. What's amazing with digital workflow, we are able to do an exact copy of a denture. Patient has their denture they've been wearing for 20 years. They don't want changes. They just want, maybe it's turning orange. Maybe it's fractured. They're having some small issues. They just want a new version, maybe new material. Their tooth structure just doesn't look as good as it used to. We can, existing denture, once those are scanned in, doctor, amazing. If you're chair side and you're able to do a 360 scan of that denture, capturing the intaglio, capturing the buccal, the lingual, everything around that denture, send us a file. Personally, I like to do a try-in at that point just to verify if there was any splicing or any issues with the scans, if the doctor did it themselves and there was any issue sending to us to verify that. And again, we're back at that, first try-in appointment. If there's any issues, wash them. A light body wash on the inside of the intaglio gives us a great intaglio, and then making any changes that need to be changed, and we can scan that back in, go to final. Duplicating it is, as easy as it sounds. We either the doctor sends us those scans or we scan them on the benchtop scanner and make an exact copy. If the patient, through and through has their teeth for 10, 20, 30 years, and they want that exact setup. The great thing about digital is we are able to pull that in and make an exact copy, send it to their door, and in one visit, potentially have a brand new denture in one visit. All right, so we're going to check out a case that was done with Mark Ludlow at University of Utah. And as you can see here, this would be that case that we have talked a few times about, fully edentulous, upper lower, where the doctor had started with the wax rims. We are going to, at this appointment, gather our video, our midline, and from those wax rims, what we're able to do is scan those in, like I mentioned, and you see here, this is our denture design being started straight from the wax rims. And this is great just for record also, just in case there's ever any confusion or pushback. Maybe, doctor thought maybe we, something wasn't followed. This is an exact copy of saying, here's, we had our midline marked. We have our wax rims in place. This is the exact setup. This is great for us. It's great for the doctors, for screenshot approval, before we even go to final. If we're trying to do this in one visit, doctors, we get it on a daily basis would like a review or a screenshot approval. Digital is amazing because we don't destroy the wax and they can't see that we followed. We can show that we have exactly what we're ready to move forward with exactly what they were seeing chair side. And then the final denture here. Now, this was designed by Mark Ludlow. The patient did ask, they did want that diastema between 8 and 9. But this would be what we could screen share with the doctor and the patient to make sure that they are on board and then send this out to the office. And what we're going to do, we're going to check out this video next. This is going to be of a patient that actually has this denture being delivered. And what you'll see is this patient is a large male, and he's going to be yanking and pulling. He's going to be trying to get this thing out of here. And at this point, I do like to mention this was a printed denture. And why I like to mention that, even though we've been talking about the digital realm, I like to mention that printing dentures versus milled dentures, the ups and downs out there today with studies are showing that milled dentures are stronger and more accurate than printed dentures. As we've seen already, some of the strengths and the benefits of printing materials and the advances we're having with these generation 2 materials versus traditional dentures or generation 1 dentures. Now, I also challenge that if we're looking at milled dentures, to understand that dentures are undercuts. And mills are unable to mill into undercuts. So there will be imperfections in milling from time to time. Now, that being said, there aren't studies out there from like Ivotion. They do not release their numbers for their strengths and the benefits, their numbers of their material. So even though the studies will show and say that the material being milled will be stronger, I disagree with that solely because we have the data here for the numbers, and we also know that the undercuts are not a problem with printing. That being said, let's go ahead and we'll start this video and we'll check out this patient with his denture at insertion.
Wow.
Well, that's what we want right there, right? Yeah, you don't have to worry.
No, that'll come out eventually.
All righty, there you see. So that was exactly what we're looking for with a denture. We had great suction there, and now, of course, that denture does come out of the mouth. Just getting used to, but that's what we're looking for. That patient is going to be very, very satisfied with that denture. We're going to have great capability. He's going to be comfortable with it. It's going to give him a better life, and that's what he's looking for. He's looking for that denture that's going to fit in properly, and that's what we're getting. Again, repeatability with the accuracy of our printers and our digital designs. We're getting a denture that's going to seat properly. All right, the processing of a digital denture. So there's two ways. Now we've touched base. We have printing digital dentures and milling dentures. I'm leaning towards printing 100%. And we'll touch base on the benefits of efficiency in lab and also costs. So we're going to compare the numbers here. So what we're going to see here on the left side of the screen is going to be our milling times for a denture. Now this is per arch. So down on the mill time / arch, that's going to be 100 or 210 minutes for a single arch. So when we look at that comparing to a denture, now print time is 90 to 120 minutes, but what the difference is with printing on one single tray, we can have up to 10 dentures. So we're looking at 90 to 120 minutes, but we can have 10 dentures done. So we're already cutting down the time significantly per arch, but then at the same time, the mill is only going to be doing one denture at a time. So that's looking at the business side of things, is how do you scale your business? If you're looking to scale your business, it's not as doable with a milled machine or milled denture. And also looking at, if you do have those mills, is it as beneficial to be running a mill for 210 minutes for a single denture when you could be running that mill for something of zirconia, hybrids, in that sense. So that's where I'm looking at the business side of print time versus mill time and what you're getting out of those benefits there. Now, of course, we did have the Ivotion milled puck come out, and they were able to cut that mill time down to 155 minutes, but that's still going back to, that's 155 minutes for a single arch. The benefits of printing are just astronomical. And then here we go. We're looking at more of the numbers of, this is for the carbon printer. We're looking at 4 dentures a day at $24 per denture, $29 per denture. So the cost of a digital denture on the carbon, we would say total price around $127. And then I do like to mention that, again, at absolute, the two machines we're using the most are going to be our Einstein and the carbon printer. So the carbon printer here, this is amazing price when we're looking at a digital denture. But worth noting that in the United States, 80% of labs are smaller than $1 million a year. And taking that into sight, not every lab can afford a carbon printer at the price point that it's at. So that's where, coming into the Einsteins, we're going to be looking at a more affordable printer, showing us all the great results I've actually talked about today with the material strength, the quality, the accuracy, and it's a more affordable printer day to day. And the cost of the material on these are corporate numbers. Of course, the corporate numbers, they can vary accordingly, but a production cost for an entire arch would be $71. So we're looking at a cheaper price on a material that is still fantastic and runs day in, day out. The process of digital dentures is very simple. Once we have the base and the tooth structure, the fusing is very simple. And what's great about this, and we have a lot of people reach out to us about, do you have anything debonding? Do you have teeth popping out in these digital dentures? Well, it's a fusing process. And what we mean by that is it's not a bond. It's not a chemical bond. We are physically fusing these dentures together into one piece. Now you have one full structure that's fused together. If you have a tooth pop out, it's not popping out with a clean pocket as you see there on the right. What will happen is you will have a full failure. That break is going to be, not in that pocket. It's either going to be a tooth break in half, a denture break in half, or something like that. It's going to be a lot larger than just a tooth popping out. Now, that being said, it sounds worse, but it doesn't happen often because we've already looked at the strength of these dentures. And I can say at absolute, we can count on one hand the amount of failures that we've had with these dentures when they're done correctly and fused properly. So we're going to see this. This is going to be about a 2-second clip. This is just the tooth structure dropping into the base. And this is what you should be seeing or going for. And this is just, again, to show the accuracy of our printers or the printers on the market now. And this is what you want. If you aren't getting these results, there's something in the software where you need to tweak your settings, but these should be dropping in. Like I said, these should have minimal hands-on work. These are supposed to be designed time in, time out accurately. And as you can see there, that tooth structure still has the supports on it. It has not been finished, neither has the base. These are straight from the printer, how they come. And they drop right in place. That is going back to the accuracy and repeatability of digital dentures. That's what we should be seeing every single time. And again, here we have a digital denture in a one-piece tooth structure. The fusing process is simple. With most materials, you use the same base structure to fuse the teeth in. And that is, again, getting that light cure to be fusing together as one piece. It is important to make sure, and that's where I said that if cured properly and fused properly, you will not see failure. Getting these pockets filled fully to make sure that there's no air pockets, there's no bubbles, there's no voids. Because of course, if you have a void, that's where you're going to have an issue with a fracture if it's going to happen at any time. Now, that being said, the importance of keeping it clean. We have ran into this at Absolute with the curing process. If you throw too much curing material into the pockets and you have squeeze out, which is what you want, a small amount, and then coming through and cleaning it up. Cleaning it up is very simple with a micro brush, making sure that we have good, clean dentures before curing, because afterwards that could cause a little bit more of a headache trying to get that material off the tooth structure. Now, with in particular, this is Flexera, and Flexera, you do have their Flexera base and their Flexera tooth structure. You do fuse with the same base material. You can use the tooth structure, but we have found that using the base material will give us a better finish and a better look. You can go either way, and that material it's cured, light cure. So as you build it up, you then cure it. It is fused together. All right, so here's one of my favorite slides. Worked on this case myself, and at first kind of hated it, but come to find out by the final product, this has been one of my favorite dentures. I love the bling bling. Personally, I don't know if I'd want the denture in my mouth, but at the same time, I love the fact that we were able to put some gold teeth. And the amazing thing about this, so the pros and cons. I know I get some questions about this. So the gold will not fuse to the denture the same way the rest of the tooth structures will. So yes, those in this situation, you would have to have mechanical bonding and the acrylic on the underside, the intaglio side, exposed to make sure we get some chemical bond. So we will have chemical bond on the acrylic aspect and mechanical retention on the lingual side of the tooth. But it's still possible, even in the digital realm, if somebody is looking for a gold tooth, to make that happen. It is out there, and a great solution for a denture that somebody wants gold teeth. Everything out there for digital, we've touched base on the dentures, but we do have the partials, flippers, provisionals, hybrids, unilaterals, hybrids, and crowns and veneers. Now, I do mention there the permanent crowns and veneers. At Absolute, we don't print our crowns and veneers just because there are better options out there, but it is possible. And with the digital realm, partials have been a big thing here lately. That is great. You know, we've touched base about dentures, but again, if you wanted to design a partial quickly, a flipper, we can design them just as fast as we can fabricate them. Now you're also getting less processing errors, and that's kind of the benefit across the board with digital is processing errors. There should be no processing errors. You can see the accuracy that we've been getting from our results of our two structure and base structures. And then even on the screen here, you can see the quality after polishing, how they come out. And these are, even on the screen, a fully printed base with printed two structure. The Zest and Compass, we do a lot of overdentures at Absolute, and designed properly, you do not need a substructure. And I say design properly, you do need to stay within the parameters recommended of 2 millimeters of base thickness. We at Absolute, I don't have a slide for this. We are fabricating digital dentures with substructures, whether we have a drop-in bar or a framework on the intaglio side. If you'd like to ask questions about that, I'd love to discuss those. Our drop-in structure is amazing. It actually does drop in from the pockets where the teeth are placed. So we actually have a mill bar that will go into the structure, and then the teeth are fused over top. So that way the bar is giving it the support. And that's in cases of overdentures where there is limited space. So we do, we're siding on the side of safety there, making sure we have a substructure just in case any potential issues may arise. But even here, you can see digital dentures with the housings in place. I do recommend these always be picked up chair side. This is one of those with the digital workflow, not a option that we have for picking up in lab. These do need to be picked up chair side. And with the printed material, most printed materials out there on the market are able to be picked up with any acrylic. They will bond similar. So even your quick up or chair side material will bond to these and efficiently work the exact same as a traditionally processed denture. So as you can see on this slide, this is our modular system. And you can see on the left, this is a fully designed case, a digitally designed bar, and then the denture itself. That's the base structure. And in this case, we did use a carded tooth solution. But in any case like this, you could, the possibilities are endless, whether we go with a carbon printed Lucitone base, a Flexera base, or as you can see on the right, the carded tooth structure, or a Flexera tooth structure as well. And then this is an example of how, kind of similar to what I mentioned with a drop-in bar. Now this is for a hybrid. So this will be going on the intaglio side. And as you can see here, as they're designed, they will drop straight in. And those are just fused in place. Now our drop-in bar technique would be from the tooth structure, dropped in and covered completely, and won't be visible from the outside. And here's our hybrids. So we have a case here by Will Linder. This was a case that was done digitally. He had gone through the process of his printed provisionals and prototype, and then the final restoration in zirconia here. So as you can see, the digital workflow has a lot of advantages, has all the strength. I believe, even looking at this picture here, it is more aesthetic. So comparing to that generation 1 where the digital dentures got a really bad name, nowadays we are getting to the materials that we're seeing that are showing much better results and highly aesthetic. A partial, this would be one that was designed fully digital. The teeth would be fused in the same as a digital denture. The supports there are a little questionable. They're on the ridge there, not on the intaglio, even though they look or appear to be. This would be a great solution for somebody who needs something quick. Now, I do mention that with this particular case, you don't have to have the clasps there printed the way they are. You can actually have a model that this would fit on, and you would be able to add wrought wire clasp or ball clasp as you would traditionally with a partial. That would just be adding a relief for the wrought wire to be dropped into and fused back in place with mechanical retention. So wrapping up toward the end of the processes, so archiving. That's one of the biggest things that we see with digital dentures. Being able to archive a denture. Now we're going to be saving these dentures for years and years. Absolutely, we do archive every single one of our dentures. So no matter what happens, we will have that file. Whether it's, maybe something happened, the doctor had taken, at their first try-in that they did a light body wash, but when they got their second try-in, maybe they realized that their wash had too much material, threw the bite off. Maybe it just wasn't as comfortable. Something went wrong. We can always go back to that first try-in and we have something to work from. We can backtrack if we need to, or let's say somebody had their denture for a few years and they lost it, dog ate it, whatever the issue may have been. We can go back to that final denture that we delivered and print the exact denture. And again, we don't have to worry about it being maybe okay. No, we know that's going to be the exact denture that they approve. That's going to be perfect for that individual. Maybe after an immediate few years down the road, or a few months down the road, they have their healing and they want to start fresh with a new denture. We now have something, instead of making a whole new denture start to finish after healing, we can send them that immediate, give them a prototype for try-in, take a wash, keep their immediate denture so they still have a denture in their mouth to wear. Well, we send them a copy so they can do a light body wash. So then we can continue the work to go move forward with while they're still wearing their denture. Now, absolutely, we're also sending what we call our smile guides. And what's amazing for that is same kind of thing as archiving. Now you have a thumb drive of your STL. So either, a lot of offices now are coming out with their own or getting their own printers, and that's becoming more affordable for offices. Whether we archive or we send a thumb drive, we are able to send these files. So if a patient does lose their denture and they're looking for that efficiency of how they can get their denture as fast as possible, the doctor can print it themselves, or we have it there on file to print for them and send to their office day of. So of course, what we've done, we labeled our dentures our forever dentures, kind of because of that original digital denture being, when it's brought up to most markets, digital just wasn't there originally with the digital dentures. Nowadays, with all the materials, we have what we want, have what we need, and we're getting the results. So we have labeled ours the forever dentures to kind of get away from that digital denture stigma. Now, this is always great to look at. So with the digital workflow, I'm sure out there, a lot of business owners are having a hard time finding employees. And as you can see here, the age of the standard technician nowadays is 55 to 64, being at 38%. As we go down in age of technicians, you can see less and less coming into the market. So that is apparent that there is less technicians coming into the market. And I'm one to prove for this, that I'm not a technician, but I came into the field to learn dentistry. And what the digital realm has worked well, and I'm a great example of this, and we have lots of absolute, that it gives us the capability to take somebody that doesn't have as much knowledge, but gives us the opportunity to grow more in a step-by-step process. I can take my more experienced technicians that are, maybe a little higher in age and move them towards the design, so that way they can help, with the experience that they have, teach others for the designing, to make sure that we have a workflow at a younger age. So I think that is very beneficial for the digital realm, is bringing in the new generation and the younger technicians to help grow the industry. All right, wrap that up, and contacts there at Absolute. And I think that should be about it.
Thank you very much, Derek. That was very good, fast moving. The work looks beautiful. How big is the lab, Derek?
Oh, we're a little over 150 people, I believe.
Okay, so that's fairly large. I think there were some questions here. Hang on. There were some questions and comment, okay?
Okay.
One is related probably to the archiving here. Is there any method you incorporate some denture identification, either denture ID or digital denture ID in digital printed complete dentures during the printing process, rather than drilling into and putting a denture ID later with a different resin? Also, do you have any insight into digital denture IDs currently available to denture care provider practitioner?
Yeah. So we do on our try-ins, of course, we identify those. We can engrave those into the print. Now, unfortunately, we do not have a method of a name tag on the final denture. When we have a name engraved, or the only solution I've come up with is printing the denture with the engraved name or initials or a number that the office has requested, and then backfilling that with a off shade, like a bleach shade Flexera Smile. And what that will do, that will give you a contrast. So versus cutting away material and backfilling with traditional acrylic, which could be causing, cutting into the denture itself could cause micro fractures, but having the name engraved into the denture at print and then backfilling with the same resin, but at a different shade. And I found that, most base shades at the red, pink, dark red, with a bleach shade from the Flexera, the light cure material will fuse the exact same as it would if it was coming from the print, but you are having to manually put the material in and then cure it the same way. That's how I approach it and get I think the best results. That way you have the same material, it's fully cured, fully bonded to it without having to introduce any micro fractures from drilling away and backfilling or adding anything to. Now with something on top of more of tracking, with some of our Zest packages, we do have a barcode system that now this system we do have to backfill with acrylic because we don't have the clear material that is as accurate. We add clear over top of a barcode that's embedded into the denture that was designed that way. And that way you can actually scan with your phone, and actually with somebody being in a like a dental or like a home of any sort, and if they have lots of people with dentures, you have a way to scan the barcode and track it that way.
Thank you.
Mm-hmm.
Derik, I would like to thank you. I would like to thank my group. It's been a great day of education. We had Waji, we had Milan, we had Derik. They review and they went over a lot of stuff. I would like to remind you that you can watch these sections, lectures again, if you like, by asking for us for a link, and we'll send it to you with a time limit. It's usually 5 days. What was important, Derik, that you mentioned on, because we do some surveys with dentists, and what they want more and more from technician, and I guess dentures too, is they want that their technician or the dentures, the people they work with, to know more on the materials than they do themselves. And especially with resin, they don't know what resin is what, okay?
Mm-hmm.
But they're aware that there are so many different resins. But I think they look at the at the lab side, the denture side, to be their information source on what resin will be the best under certain situation. That's what I've heard from our surveys. Anyways, guys, I remind you that, I think it was a great start. It was great to have a DAO to participate. I would like to remind you that you guys also get, a discount on all the courses that we do. We got some coming up. We have a radiology course. We have a digital denture training, okay, designed for 3Shape coming up. You got to go on the website. That's in the end of April. We have a CAD/CAM design. That's a 7-day course on ExoCAD, okay, and we're using the curriculum from Pasadena City College in the US and the University of Southern California. And we have a digital cooking design show, which is 3 days, okay, and that's for dentists that are, I mean, everybody can participate, but I'm structuring this because dentists asking, like tricks and hints and what does it mean to design. A lot of them don't, and they think that if they buy a printer, they can just put it in there and boop, the denture will come out, and then they realize that they need to design, the file that they need to send to the printer. So there's demand for that, okay, guys. So check them over, and then let us know what you think. We welcome your feedback. I got to phone Conrad on Monday. It's a holiday here, but not in the US, and I got to thank him for sending you up to us in Canada here with your lecture, Derik. It was wonderful.
Thank you.
To all the Canadians, the Ontarians, okay? Happy Family Day. We don't work on Monday. It's a family day. I don't know if it's a Canadian thing. I think it is because it was mandated by the federal government. So happy Family Day to all you guys, and check the dates for the next one, okay? The next SDA is April 15, and the next TIA, Toronto Implant Academy, is March the 10th. Go to Global Dental Mentorship, and you can get all the information. Okay, again, thank you to Julian, to Alex, and to all the speakers. Have a great weekend. We'll see you soon. Thank you, guys. Ciao.
Thank you.
Ciao, Derik.